So what's the most common part of the hand that you'll see with arthritis complaints?
Yeah, so one of the most common problems we see in general in the office, and certainly probably the one that brings people into the office the most with arthritis in the hand, is arthritis at the base of the thumb, or basilar thumb arthritis. It's also called thumb CMC arthritis, which is the CMC joint that's affected here. And that usually brings people in because it causes pain right here in the thumb, and it causes pain with any heavy gripping or key pinch. What types of things do people complain of when they're having basilar thumb arthritis?
Yeah, I mean, all related to those maneuvers you were talking about. It's typically pain here, and it's pain with gripping, and it's things like I can't work in the garden, or I have a hard time working on my car. Gripping a steering wheel even can hurt. Even driving can hurt. So anything that really involves that thumb and grip and pinch is really what gets them. And sometimes, as you know, when it's bad enough, it just hurts. Even at night, it'll wake them up at night. So
yeah, dull like a toothache. People sometimes say it aches like a toothache all the time. And so if somebody comes to the office, haven't tried anything, it hurts me to grip, it hurts me at the base of the thumb, what are some of the things we start to talk to them about as first line treatments?
Yeah, great. I think the thumb arthritis is probably the great thing to talk about, because that is probably the most common thing we see. So I typically say, well, let's see how it is. Let's start with a splint. There's a splint made specifically for that body part. I tell them it works very well, and that's a great way to start, because there's no harm in starting it. And for some people, if they can wear it and calm the arthritis down, they don't need another intervention for a while. How about you? So let's say we did the splint and you came back 4 weeks later and said that didn't quite do it for me.
Yeah, and that's exactly right. And we have pretty good data to show that the splints work well and oftentimes can modify the long-term outcome. But yes, we use the same splint unless there are some patients that have thumbs that don't fit in it, and you start to get a change in the architecture of your thumb. So there's some that we actually have our therapists make a brace for. Yes. That's right, so splinting is a great way to start. If the splinting is unsuccessful, a lot of times the next step will be a steroid injection. And what a steroid is a powerful anti-inflammatory, kind of like Advil or Aleve. It's a different class of that, but it goes in directly into the thumb joint and decreases the inflammation, so it takes away a lot of that inflammation, and the inflammation is what causes the pain. So that's kind of the next step in the treatment algorithm for me. What types of things do you tell people after a steroid injection to expect? How long is it going to last? Are there any side effects?
Sure. I tell them I would hope for almost 100% pain relief. Actually 100% pain relief is an attainable goal with a steroid injection. I tell them it should last 3 to 6 months. It could last longer, it could be shorter. And the main side effects, beyond the bad one, which would be infection, which is rare, would be the steroids can bleach your skin and thin the fat, so it may change the way the thumb looks, but for the most part, they work very well. I think most patients do start with that, but there are some that, for some reasons, you can't do steroids. So what would you do if they say, well, I'm allergic to steroids, or I can't take steroids? For some people with diabetes, I don't want to take a steroid. Mm-hmm. So what's your next thought on that?
Yeah, so if all the other treatments have failed, we've tried anti-inflammatories, we've tried bracing, and either we've tried steroid injections or someone is not willing or can't do steroid injections, really the next step would be surgical treatment, surgical management. So going in and modifying the joint permanently so it doesn't hurt anymore. And the number one reason to do that surgery is pain relief, so to help with the pain. And usually we do that when the pain's significant enough to affect everyday life, aching, causing you to not be able to sleep at night or not be able to do your job. And Dr. Dovan and I have talked about this extensively, and we do a very similar surgery. So what type of surgery is our treatment for this?
Yeah, so you're right, we do it pretty much the same way. We take out a bone called the trapezium. That's a bone at the base of the thumb, and that's where the arthritis, that's half of the interface of the arthritis. If you take that out, your arthritis is gone. And then we use a tendon to stabilize the thumb, because if the thumb becomes loose, it can create a different type of pain. So yeah, we've been doing that procedure the same way for a long period of time. And what's a good question that gets asked that we answer is, how long is it going to take me to get over this surgery?
Yeah. So recovery from the thumb CMC arthroplasty or the thumb arthritis surgery, it varies from person to person, but the kind of guideposts I give people is we put people in a splint for about a week and a half afterwards, and then they come back in and you'll go into a removable brace. That brace usually stays on until about the 6-week point after surgery, and then we start to wean you out of the brace. I think we both start therapy right around the 2-month period, just with really getting the thumb stretched out, getting it very mobile, and then we usually let people get back to normal activities at about 3 months. Right.
Yeah, that's very, yeah, I do about 4 to 6 weeks start therapy. Don't go very hard. You're working on mobility. And my comment is I think you will be mostly healed by 3 months. There may be some things you don't want to do until 6 months, but I think 3 months is a pretty good landmark or a good target for majority of recovery being done.
Yeah, and recovery is not as straightforward as when am I going to be healed, because at 3 months, like Dr. Dovan said, you'll be back to doing most things. We'll cut you loose to do most activities you want to. And I tell people with pretty much all the surgeries I do, you'll continue to improve that activity and the pain will continue to dissipate. But it really takes about a year for your body to forget it ever had the surgery. While you're still doing activities, your pain's better, your grip strength oftentimes continues to improve, but it'll continue to improve for about a year afterwards.
I agree with that.